Hello everyone, I am Dr. Vivek Venkatramani, consultant Uro-Oncologist and Robotic Surgeon in Mumbai. Urologic cancers are cancers involving the urinary system as well as the male reproductive organs. These cancers are among the top 10 cancers in men and a couple of them in women as well. There are certain signs and symptoms which may help us to diagnose these cancers early, and this leads to much better outcomes in terms of cure rates. However, these signs and symptoms are often ignored, especially by men, and this leads to late presentation and worse outcomes. Some of these common signs and symptoms include hematuria or blood in the urine, which is the most important cardinal sign of a urologic cancer. Any patient who has blood in the urine has up to a 10% chance of one of these urologic cancers, and that's why this symptom should never be ignored. A lot of people think that this is most commonly due to urinary infections, and while that may be the most common cause, a 10% chance is quite significant and requires a thorough evaluation by your urologist to ensure that you do not have any of these particular malignancies. Second common symptom which is often ignored is a vague pain in the abdomen, on the back, especially in the kidney regions or in the lower abdomen. These may turn out to be signs of kidney or urinary bladder cancer. These are often vague symptoms, and it is only in the later stages where kidney masses may present with large lumps which can actually be felt by the patient, and that's why if you have any such vague symptoms, a simple ultrasound is a very useful screening technique that can be used to rule out any major issue. Third common symptom is any difficulty in passing urine, which may be in the form of both storing urine, where the patient feels he has to go very frequently, is unable to control or hold the urine, and may leak out urine before reaching the bathroom, or it may be in the form of passing urine in the form of a poor flow or taking a long time to complete the urination. These symptoms can also be related to both prostate or urinary bladder cancers. With age, there is a natural growth in the prostate, which is known as a benign or a non-cancerous enlargement of the prostate. However, these symptoms can overlap with prostate as well as urinary bladder cancer. Therefore, whenever a man presents with these symptoms to us, we always evaluate him from these perspectives as well. Don't ignore these symptoms, because if by chance you would have a prostate or a bladder cancer, an early diagnosis certainly helps in achieving excellent outcomes in the long term. In younger men, an important symptom that may be ignored is a painless enlargement of one or both testicles. Most men in this age group would have a hydrocele, which is just a collection of fluid around the testicle. However, there is a significant risk, especially in the age of 20 to 40 years among men, that testicular cancer may be the cause of that hydrocele or water collecting around the testicle. Again, a simple ultrasound of the testicles will tell us whether the testicular architecture is normal and is just a simple hydrocele, or whether there is a lesion within the testis which needs to be evaluated further. These are just some common signs and symptoms which, if you have, please don't ignore them. There is often a lot of stigma among men, especially they feel embarrassed and scared to come forward with these symptoms, especially if they are younger, and that's why this can lead to a lot of delay in the diagnosis and therefore allow the cancer to spread to other parts of the body, and where treatment may not be as effective. Risk factors for urologic cancers are similar to those of other cancers. In fact, people are sometimes surprised to learn that even smoking increases the risk of almost all urologic cancers. The kidneys, the urinary bladder, the prostate, upper tract urothelial cancers, and even penile cancer incidence is increased by smoking. Other risk factors include obesity, which is associated with prostate cancer as well as kidney cancer, and a strong family history of any of these malignancies. In such men, we would recommend screening even at a slightly earlier age in order to make sure we catch these cancers in an early stage. Let me just give you a couple of examples where a delay in diagnosis proved quite costly to the patient. There are examples among our urologic and doctor community where the doctors themselves who had a growth on their penis delayed coming out and getting diagnosed and ultimately succumbed to penile cancer. I recently gave an example in one of my other videos of an IIT graduate with a testicular swelling who was refusing to believe that it might be a testicular cancer and thought it may be tuberculosis, and it's been 6 months and he still hasn't come back to me for a surgery. There was also an example of a patient who had an elevated PSA in the range of 5.5, and this was detected just before COVID. Unfortunately, because of the pandemic, he kind of forgot about it and did not come back for follow-up. And by the time he came, it was 2 or 3 years later and the PSA had become 75. And the prostate cancer, which was at an early stage at that time and would have been probably cured by treatment, had already spread to the bones. So this just gives us an idea where the delay in treatment can be quite costly, and that's why I would recommend that if you have any of these symptoms, if you are above the age of 50 and if you have a strong family history of any of these cancers, please speak to your urologist or uro-oncologist and get yourself screened and evaluated for the presence of any of these malignancies. If you found this video informative, please like and share it with others, and don't forget to subscribe to my YouTube channel.